Okay, I'm Dr. Z and Becky's here, and Dr. Cooper?
I'm the guinea pig.
He's the guinea pig. And what we're going to do is we're going to have a quick training session on the Accupal product. And there's a little on-off switch right here. You click the top one, it comes on, you see the light come on. This is actually vibrating. The off switch is here. We'll talk later about it. It's powered by a AAA battery. Now the business end of the device comes in a sealed package. These are individually wrapped, and these are disposable. They're single use. You use them one time and get rid of them. What we're going to do today on Dr. Cooper is demonstrate how we would typically get profound anesthesia on number 14, which will involve infiltration over the buccal cusps and then the dreaded palatal. And I want you to pay particular attention when we go to do these shots. I always like to look at the patient's forehead and eyebrows because they'll tell you everything of how good you're doing. The tip has a contra angle in it, and one end is funnel shaped, almost like a funnel cloud, and the other end is shaped like a dappen dish. We're going to always put the needle, when we do use it on the palate, through the flared end. Now the disposable tip, it doesn't have to be put on real tight. Otherwise, you'll probably tear the whole thing apart getting it off. Because remember, this is going to get disposed of before the next patient. The motor gets reused and wiped down. You can sheath it if you want, or you can just wipe it down with, it's built to withstand glutaraldehyde or any surface disinfectant. Okay? So, first thing we're going to do, this is a beautiful, one of the features, in the dappen dish side, we're going to go ahead and load it. And you can use any type of topical anesthetic. I do prefer a fairly viscous one because some of the compounded ones are very runny, and with the patient in the supine position it tends to always want to go down the throat instead of where you need it. So for the buccal injection, do you have a short lasting carbocaine? Yeah, Claire's carbocaine's fine. Yeah. We don't want them going too long. Plus, I'm only going to deposit a couple drops too. If you notice, we don't have to have any fancy syringes, no machines sitting on the countertop. Use your typical armamentaria. And if you want to pan in, and it may not help it. Sometimes it's better without. Kind of let us know how it's doing. But what I like to do is get the patient nice and relaxed. And he's a great patient because you notice we can get his lip kind of relaxed. If you notice when you keep the tissue flaccid, see that vein artery running right there? That's one place you want to stay away from. Take the end with the topical anesthetic, and I just tell the patient it's almost like an electric toothbrush. It's about the same feeling. In fact, kids can really relate to this because they all have Dora the Explorer, this and that. And I just rub it on for just a few seconds. The motor and tip are then just set to the side. We're going to use that again for the buccal, for the palatal. And then we're typically going to just take the tissue, pull it up, and then get it flaccid. And if you notice, I'm going to infiltrate over the mesiobuccal root right now. And you can do a little shake if you want. And we're just slowly depositing a few drops of anesthesia. If you notice his forehead, you shouldn't see much of a reaction at all. Now, typically if we were going to numb this for profound anesthesia, we'd come over the distal buccal root also.
That wasn't bad at all.
One bad, and you know,